Hey, everybody. Welcome back to the Modern Customer Podcast. I'm your host, Blake Morgan. Today, my guest is Alex Greengold, the Chief Consumer Experience Officer and Senior Vice President at Memorial Hermann Health System, based out of Houston. They are committed to safe, high quality, patient centered care. The system combines clinical expertise, innovation, and advanced technology to serve every patient. Prior to Memorial Hermann, Alex had roles at DISH Networks and AOL, where he earned multiple JD Power Awards for customer satisfaction. Today, we're talking about technology, about innovative ways to use AI and apply that to patient and employee experience in a healthcare environment, and so much more. Please enjoy Alex Greengold. Alex, welcome to the Modern Customer Podcast. It's so nice to see you. Are you in Texas today?
I am. I'm at home. I'm working from home today in Houston. So, yes.
Does it feel like fall in Houston yet?
Uh, you know, Houston's pretty muggy until we're getting there. Leaves are starting to fall. Yes, close.
Oh, awesome. Yeah, I love Texas really is a great place to visit. I feel like there's so many business conferences and so much business happening in Texas these days. Does it feel like Houston has changed in the last few years?
Yeah, I've only been here for 6 years, but it is booming. It's a huge city. It is hard to even describe to people how big Houston is unless they've been here. I mean, it's like LA, right? From one side to the other is 100 miles and just highways everywhere, and a lot of business, a lot of startups, big medical industry where I work. But yeah, it's a cool area. A lot of good food, culture, that kind of thing. So
So you moved to Houston for Memorial Hermann in 2019. Do you want to talk a little bit about your background and why you took the leap into this new role?
yeah, I'm glad to. I started my career after business school a long time ago with in a totally different industry. I worked in the TV and internet space for a long time. I worked for AOL early in my career for a long time, and everybody when I talk to folks and tell them that, I always say, you know, you used it or your parents used it, but somebody used it to get online, and it was at that point the largest company I think in the United States, at least market cap. And so huge consumer base. We were doing some really cool things. I was young. I was just kind of learning the ropes of corporate America and trying to move my way up. And then after that kind of started to fall apart, way longer story for another day, but I ended up at another big organization, Dish Network, big TV company. When I was at Dish Network, I was there for about 10 years. We were really focused on call centers, customer service operations, and the things that, I grew up in my career doing. But I realized quickly that it wasn't so much about answering 100 million phone calls a year. It's how do you stop the phone from ringing? And frankly, we started thinking about how do you reduce phone calls? How do you get people to be happier with their service and create a better experience? So our team developed a consumer experience team there at Dish, and it was kind of groundbreaking, right? This was kind of probably 10 years ago or so. And we made some big change. We started mapping everything. We started figuring out where pain points existed. Anyhow, long story, but we started winning JD Power Awards. We were doing very well in that industry, and I was helping lead that effort with a great team. And got a phone call that said, "Hey, what about healthcare? Would you like to do this kind of work in that industry?" My dad's a doctor, my mom's a nurse, and thought, wow, this would be pretty cool to do experience work on the front lines of healthcare. And everything really worked out. And Memorial Hermann's been such a great organization to have transitioned to. It was just a great collaboration. And I thought, let's go, let's do it. Picked up my family from Denver, which was a big move at that time, 3 kids, and moved to Houston 6 years ago. So here I am. But that's a little backstory.
So, for those of us listening all over the country and the world who might not know about Memorial Hermann, can you just talk a little bit about the health system and how it breaks down?
Sure. Yeah, we are a big nonprofit healthcare system, probably, I think, the biggest in Houston for sure, and maybe one of the biggest in the state. We have 40,000 employees. We are a massive employer. We have hospitals, all over the city, from the farthest stretches of the suburbs all the way into the inner city and the big Texas Medical Center. We're a 115-year-old company, 118, something like that, long standing, great employer in the area. We a standout in a place that people want to be. And frankly, if you have emergency needs, trauma, you're going through cancer treatments, or everything from having a baby or a knee replacement, this is the place you're going to come. We do have competitors locally for sure who are really also great. So it is a competitive environment, but it's a big organization. We have about 6,000 physicians. I want to say 15 to 20,000 nurses. It's just a big organization. We have clinics, imaging centers, surgery centers, freestanding ERs, and about 15 different hospitals, give or take one or two, depending on how you count them. But that's the landscape.
Love it. And when you came in 6 years ago, what was your mandate as far as and patient experience?
Yeah, so when I came in, this was not a department. I was given the opportunity to start this from scratch, which was another reason I wanted so badly to take this opportunity. I thought it was fantastic to think through what is the organization going to look like that you're going to build. And so 6 years ago, it was just an idea of, okay, we're going to need an analytics team. We're going to need people that can grasp the voice of consumer, that can work across our system. We need like a field team that can be out there generating help on a daily basis in and out of our hospitals and our ERs and our clinics. So we put people out in the field. So all in all, I would say we built this team, kind of a central team that works across our entire healthcare system. And we're small and we're growing. And 6 years later, we've built a really solid 4 teams that sit underneath me, and then we work across the entire system, and we work with a lot of different teams to drive high levels of patient experience.
Love it. I mean, that's a lot of people that you're responsible for. When we think about innovation and culture and doctor and patient experience, I should say staff experience, like how do you even begin in your first 90 days to figure out with this huge mandate, like where to even start?
Yeah, it was tough. I had to kind of lean back on my prior experiences and figure out, okay, what are the things that we need to go do? How do we organize um, thought around this system? And I won't say that Memorial Hermann didn't care about experience before I got here. That's always been a thing, but there wasn't a specific department and a team that was focused on it from a strategic standpoint. So I started thinking about I need folks who are really smart, who are talented to think about the patient journey. And again, I mentioned earlier, it could be anything from, heart and vascular neurology, orthopedics, oncology, like you name it. There's a journey that a patient is going through, and we want to make that as good as we possibly can. And so we really had to build a team that could design the best experiences possible for patients along those journeys. We need to be able to collect feedback. We need to be able to analyze that feedback. We need to be able to share best practices throughout the system, and so on. So it was, a little bit of trial and error. Some things we did really well. Some things we struggled our way through, or we had failures from time to time. But at the end of the day, I think we have been very successful in being able to get a culture built around service here now, which has been great. That was kind of one of the first things we did actually, was really focus on culture.
Alex, let's talk about the role technology played in rolling out these customer experience programs. We talked about first 90 days in the last question. How do you even begin to come up with a technology strategy in a large healthcare system that really supports these experience initiatives?
Yeah, technology plays a massive role. We don't own the technology. We have partners in other departments. So we've got a digital team, which is working on the digital experience that we work very closely with. We have our IT partners, and we've got people that are orchestrating data from the patient in our big electronic medical record systems that help drive some of that. But when I think about the patient journey and technology, we've done a lot of work on that front. We started putting in place a better system to allow a patient to schedule appointments, a better system for us to communicate with you around your appointments, whether that's a text message or however you want to be notified. We've built an app that allows using MyChart and other platforms that we've kind of built on top of that to be able to give you what you need in a timely fashion. I'll give you one really cool example of something we did with technology recently, which took a few years to get there. But for years and years, if you were having a knee or a hip replacement surgery, this is just one little example, but something really cool we did. We used to hand you a book of about 48-page book that said, here's what to expect when you're coming in for this procedure. And most people wouldn't read it. They just glance through it and throw it off to the side. We said, why don't we create a really cool digitally engaged journey for that patient with video content of why you need a coach and what to expect the day after and what exercise you should do. And every one of them is sent to you in a timely fashion leading up to your surgery with here's who to call if you have a problem, or here's when your dates are, where you need to be, when you need to be there, how to navigate. We built that all into one really cool platform using a couple different technologies, and it's been great, right? So ditch the old 48-page book and make it more digitally engaging for the patient and their family. Not everybody wants to do that. Some people want the book, and that's okay. But the majority of people are coming along for that ride because I think whether you're the consumer of their hotels or Amazon or whatever, you have those same expectations of your healthcare provider. So we are really trying to play in that space and make a great journey. And the cool thing about that one is I can actually track, right? So we can see who is watching what videos, who's not engaging, and it gives us the ability then to call you and say, what can we do to get you ready for your upcoming procedure or what have you? And we can ask you questions along the way, like we can kind of survey as you go. So that's an example of how we use technology.
And I love that. That's so amazing. As someone, I've had surgery where there are things that you need to know. And most of us, when we have a medical procedure, it's nerve wracking, it's
Right?
scary. So I'm sure having those videos really does help. Do you have any kind of metrics that tell you if the patient, like how many patients complete the video series or like tracking the amount of outreach you did? Like what are the metrics that tell you that the program was successful?
Yeah, we can look at a lot of different engagement pieces in there, just like any other sort of digital engagement. We can see how many we've sent, who's opened it, how long they've watched, where they've stopped, if they've seen the whole series, what they haven't seen, right? And we can follow up with them. A human can follow up with them and have a conversation if needed at any point along the way. So yeah, we've got some pretty good measures there. The ultimate success measure is at the end, did you have a good clinical outcome? Did you tell us you would refer us to your friends and family? Like, would you recommend, right? Those are the big
Mhm.
things we ask in the end. Did the NPS score actually improve based on some of these programs? Which is ultimately what we're after as an experienced team, is driving the highest level of NPS that we possibly can, which is, would you recommend this to a friend or family member if you were in that same position? And we watch that very closely across everything that we do. So
Right, and not only NPS, but now Fred Reichold has said, well, actually, if you could track how many of your new patients come in through referred patients,
yeah,
those patients or customers are just better customers. They're more loyal, they spend more money, they refer other really good customers. So not just NPS referral, like, would you refer us, but actually, like, did you
yeah, did you?
refer us?
Yeah, right. I've
Yeah.
seen that they want to tweak that a little bit. We ha-
Yeah.
we haven't quite gotten there on that. We just kind of introduced
It's
them
hard to track.
to our system a couple of years ago, but we're doing a lot around feedback from patients. One thing I might mention there that's actually something really cool that we're building. There is this thing, I'm sure you hear this from other folks you talk to, around survey fatigue, and people just
Yeah.
tired of, you go on vacation, you get a survey from the airline and the hotel and the rental car and the dinner place, right? I mean, we have to sit back and think people are less and less and less taking surveys and inclined to take surveys. So what can you do to get feedback around the work that you're doing? And we've started building actually predictive models, kind of modeled after, I think, other industries do it really well. Like, if you're, the analogy I like to use is an airline. Airlines do this pretty well. If your flight was delayed and you had a bad experience, or they lost a bag or something like that, which has happened to all of us, I think generally speaking, they know that you've had a bad experience through the data. They don't have
Right.
they already know that your flight was
Yes.
hours delayed. They don't have to survey everybody on that plane. Oh, guess what? We had a bad evening last night. Yeah, they already knew. Same thing with an ER. I mean, if the ER experience takes 7 hours to get through for a lot of different reasons, and hopefully that's not what happens, but on occasion it does. Um, we already know that. So if we know that you probably had a bad experience, what can we do about it and prepare nursing? And if you're admitted to the hospital, let's go have a conversation with you about, maybe we dropped the ball, or maybe it wasn't the best experience it possibly could have been. How can we make that better for you? Or let's talk about that. So it's kind of a recovery effort upstream instead of waiting for a survey to come later. So we're putting a lot of work
Yeah.
to this predictive ability. So
I love that. The worst thing you can do as a brand is like, yeah, send like, how did you like this experience? Or I get that a lot for retail. Like if I'll
mm,
buy something from an e-commerce vendor and then I return it and they still say, would you review this shirt for our website? It's like, well, don't you know I returned it? Like, no, I don't want to review it. I didn't like it. So it's just about honestly like presenting your best self to the customer.
yeah, yeah, and things get disconnected easily, right? So when that happens, it's good to be able to recover from that and at least have conversations. We round on all of our patients, and we've got leaders who round on patients. We have nurses who round on patients and physicians when they're in the hospitals, and giving them a little more data before they walk in that room that this person might not have had a great experience before you're about to walk in here. So you might want to address that, right? That's the kind of thing that we're doing to really take this to another level that I don't know that has quite broken into healthcare yet in a big way, but we feel like we're kind of on the leading edge on some of these things. So it's kind of cool.
Yeah, I actually had an interesting healthcare experience, which I'm sure people tell you these things all the time. But I went to my healthcare provider and I walked in. It was like the women's clinic, and at the front desk, they like, I guess there was a change in my insurance, and a new test only will be covered every 5 years instead of every year. But they like shouted it at me in the reception area. They're like, "Would you like this?" And it was like a private. It's just something you would want to tell. And
Yeah.
I love this brand, like, they're a great healthcare provider, but I told them, I'm like, "I don't think like, that's not a great experience, like,
Yeah.
please don't yell." It's like
Right.
when you go to a hotel and they're like, "Okay, your room number is
Right.
1022."
Right. Right. Does everybody need to know that? Yeah. As a matter of fact, this afternoon, we have a call about how can we prevent somebody walking into the ER, for instance, and going, Blake, are you out here? Right. Like saying your name publicly. We try to avoid that, but that happens every day. So we're trying to figure out if a restaurant can give you a little beeper that, or a phone number that,
Yeah,
why can't
right,
we do that?
for
Right.
a text.
Yeah, even better,
Yeah,
a text. So we're
yeah.
we're investigating, can we use some of our texting capabilities today to just tell people we're ready for you, come on back, versus somebody screaming your name or what test you're about to have. So,
It's like you have to to be a customer experience leader, which from our conversation right now, it really I can tell that you're holding your brand to a very high standard. That you have to micromanage every aspect and you really can't leave anything up to chance with staff because if you don't communicate exactly how you want an experience to be delivered, it is a little I don't want to say sloppy, but when you let people interpret things as they want, I don't think that's a great brand experience or customer experience.
yeah, we have great employees, but I think it's difficult, right? They're doing what they do. They're saving people's lives. They're running from room to room. They're in emergency situations, and even if they're in a hospital setting, there's a thousand things they're dealing with all day, every day. So, thinking about the best experience or the best service for somebody isn't always top of mind. So you have to. That's a big part of what I do and my team does is we have to be out there re-emphasizing the value of the work that we believe we should be doing and the way that we should be talking to folks and how we should be engaging with people, and that's not always easy. You're right. We're sometimes down the list of people's priorities, right? So
So, you talked about a few really cool things in our discussion today. You talked about using predictive analytics and modeling and things that I don't hear about all the time that you're going after these difficult metrics and technologies. I can't let you go without asking you about AI and the ways you're looking at AI to proven efficiencies and patient and staff experience. Any AI success stories you want to tell us about that you've had so far?
Yeah, there's a few, and we're really diving deep into AI, and we've got an AI council internally that every AI project has to kind of go through because every vendor in the world is pitching you their AI products at the moment, right? So we've got to figure out the right way to do that, especially when it relates to clinical AI, right? Like being a doctor, giving advice to a patient. The things that we have gotten success with so far are one around discharge phone calls. So in the past, a human being would call every single patient. You've probably had that call if you've ever been in a hospital or a outpatient setting. And how are you the next day? How are you doing? Right. What we found was about 80%, 90% of the time, the patient, yeah, everything's great. So why do we need a human being to make 1,000 calls a day to do that? Why don't we have a really good AI make that phone call, have that conversation? And if something needs to be escalated, we send it to a group that can do that, but they don't have to make all those calls. And we can do it all at once, right? We can call everybody, right? It's done. Um, that's been fantastic for us. We get when we need to speak to somebody around their medications or a follow-up issue, we can route it to the right person. So that's one. The other thing that I would say is we're building right now using ambient listening in hospital rooms, right? So we're testing some of that. We're in doctors' offices where our conversation is being monitored and recorded and noted in a way that can put the most relevant things right into the record. And now a doctor has to actually go back through that and make sure it's all accurate. But instead of them typing and typing while they're talking to you, which you have had that, I'm sure, imagine if something could just pick up that whole conversation and the patient knows it's happening. It's great. And it allows the AI to actually transcribe the whole thing in a better way, which makes everybody more efficient. So that's kind of a big thing that we're leaning into and testing. A lot of these are early days with AI, right? The other one that we're playing with an idea, and I won't mention any vendors, but we've got this company that has built this really cool product that pre-procedure or post-procedure can make a phone call to you and talk to you about anything that you might have questions about. And it's fantastic. It can talk to you about anything. You can ask it 1,000 questions and it sounds like a human. I mean, it really sounds like a person. So it
Mhm.
can empathize. You can talk about anything. You can talk about the weather, what kind of food should I be eating, my diet, whatever you want. And it's got good answers. And if it does go awry, again, there's kind of an escalation path out of it. But and then there's a lot of AI, and we're early with that. We're just starting to play with that too. But the other thing that we do from like an efficiency or an employee standpoint is we get so much feedback from patients on surveys or otherwise. And wouldn't it be nice if you could just have like a chat GPT kind of function, summarize all that for you and say, in the ICU unit of this hospital, here are the three biggest things you need to work on to improve your NPS. Boom, it's done. I don't need to read 1,000 comments and look at all the data. So using AI to help interpret data and hand people what they need, right?
Yeah.
Those are
I
a few
love that.
sources, but yeah, we're diving deep in. So
That's awesome. I love that. How much of that is your scope versus like the chief technology officer?
yeah, we have a chief digital officer who I work closely with. There's a working group. There's an AI council, and we bring all these things there. But I have the lens of the experience of the patient, right? So I'm fighting for the patient and what's most important to them. But then from how they actually go build the technology and it integrates with our other tools and platforms, that's more on the digital and IT side. But we usually have clinical folks, we have legal folks, we have doctors, nursing. So we bring in this big network of people, kind of cross functional, to make sure that we feel good about anything that we're going to put in place. But we're driving it from a better experience standpoint, typically. So
I've heard about this ambient technology that you're talking about, but it's interesting because the other healthcare executive that shared that with me, it's up to the doctor to choose to use it or not. And it doesn't really sound like it's up to the doctor, but I could say the worst experience is when a doctor's typing and not looking at you.
yeah,
So, I mean, I don't think sometimes the patient experience should be up to the doctor or the individual. It should be up to like someone like you that's studying the patient experience.
yeah. I mean, we work closely with them, and we're not going to force them to do something that they absolutely don't want to do. But we want to prove to them that it's
That it's worthwhile.
yeah, for sure. So, I mean, how many times have you been in a office setting where they're just looking at their screen and you're over here, right? So it's that happens.
Yeah.
So
Yeah. It is nice to have some eye contact and not the typing.
right,
I think that's
they're
important.
there with you, right? Yeah,
Yeah, to be with you, really. That's really the essence of hospitality also and a patient experience is, are you with me? Are you against me? Are you
right.
going to advocate for me, care about me, or is this a transaction? Am I just a
Yeah,
wallet
for
as
sure.
a patient? Alex, I'm so glad that we got to record this podcast today because you really are a leader in customer experience. And I just love that you really are a great case study of a CXO that's using all the technology at your fingertips to actually try so many cool new innovative things.
I appreciate that. Yeah, I feel lucky to be part of a team that's like leading edge. We're going after what's out there right now and trying to be right on the leading edge of everything happening with AI to really make experiences better for the people we serve, right? So,
Yeah, it really just starts with leaders that care. That's all it is.
yep,
So with patient experience, healthcare, I think it's just refreshing. It's wonderful to hear your story. But we can't let you go without having some fun and doing some rapid fire. I know you have a big healthcare system to get back to, but let me ask you a few silly questions so we can get to know you a little bit.
sounds good.
All right. What is the most important part of your morning routine?
You know what's weird? Like for the last couple of years, I've done a Wordle every morning. I do the New York Times Wordle thing. It's like a little
Mhm.
puzzle, and you do it on your phone when you wake up. And I just gets my brain like before I even get out of bed. Like I'll get my phone and it just gets my brain going early in the morning, and then I get moving, get some coffee, and get my day going. But on days where I have to drive into the office, you might have to get going a little quicker. But I always try to get that thing going early. Like I have a streak. Now I got to hit my record, right? So it's kind of like a
Absolutely. Yeah, the New York
competition.
Times is waiting. They can't even start their day before Alex completes the Wordle. Yes.
That's right. That's right.
Um, well, in contrast, what do you do to relax at the end of a hectic day?
I've been going to the gym a lot, but I try to do that in the evening. But I play a lot of golf. If you can't tell, like what's around me here, but I am a big golfer. If I can get out on the golf course, that's where you'll find me on the weekends or sometimes later in the evening or whatever. But yeah, that's and I've gotten into pickleball lately. So
So fun. So
yeah,
fun.
getting way into pickleball.
What show, if you watch TV or movies, are you currently streaming right now?
I just finished of Your Friends and Neighbors. It's with John Hamm. It's really good.
Yeah.
It's a fun little, whatever. And my wife makes me watch Love Is Blind, which is better than The Bachelor. I will admit, but yeah, I watch a lot of stuff. When I was traveling a lot, I watched more. But you can always go back to the Breaking Bad.
Right. Breaking Bad's a classic.
Right.
What's your idea of perfect happiness?
That's a tough one. I've got 3 kids, 2 are in college, and just being with my family, like, it's either my wife is big into the mountains, I'm big into the beach. I grew up in Florida on the beach, and so, like, somewhere in between one of those 2 things with my family is kind of my vision of happiness, I would say.
Got it.
Yeah.
What's your favorite type of vacation?
It's always a debate in our house. Do you go to like last year we went to Europe, see the castles of the cities and all that, or just chill at a pool next to a beach kind of thing. I like that one, and then my daughter's way into hiking and like the big adventure. But me personally, I'd rather be at the all-inclusive resort at the swim up pool bar. That would be my favorite vacation. I
Hmm.
get outvoted a lot. So,
Yeah, nice. Your family, they sound like they like to have fun and they like adventure.
yes.
Um, and if you had to describe your outlook in one quick motto, what would it be?
I'm kind of a risk taker, so I would say, you know, put yourself out there. Go sometimes be uncomfortable, right? Like I'm often in a situation where, I had to this morning I had to present to a group of like 300 people already, and I
Mm.
just came back and to do this. But you're often putting yourselves in uncomfortable positions, and I think that helps you grow. And The other piece is like you really have to go after what you believe in, and you can't sit back. You can never just sit back and wait. You have to be the one kind of pursuing and pushing and fighting for what you believe in and fighting for your team and
Yep.
fight, in this case, fighting for our patients. But yeah, somewhere in all that would be a motto. Yeah.
Alex, this has been so fun. I really have enjoyed getting to know you. Hopefully, you'll come back. And thanks for doing the
Totally.
show.
You got it. Very cool.
Everybody, you've been tuning into the Modern Customer Podcast. Until next time. Thanks for watching. Please don't forget to like or subscribe and follow my social content on other platforms where I post content daily, including X, Instagram, LinkedIn, TikTok, and more.